My name is Joseph Muchter, and I'm a paediatric gastroenterology doctor from London. Welcome to our audio and PowerPoint presentation of our poster for BusBegan Conference 2024 on the outcomes of diagnostic endoscopy in newly presenting children with gastrointestinal symptoms during and after the COVID-19 pandemic. And this is our poster, which you may well know as you may have clicked the QR code to get here in the first place. But if you didn't and you'd just like to hear about our study, please stay with us. So why did we do this study? Well, paediatric endoscopy is really important in our day-to-day practice in diagnosing and ruling out GI pathology in children. But we don't really have strong data to guide who we scope and why we scope them. And the current data that does exist is based on weak evidence and low quality evidence. Our team had previously published a study looking at abnormality rates, both macroscopically and histologically, in children undergoing first diagnostic endoscopy, which can be found via the references. And that found that only 35% had histological abnormalities. Now, in the context of increasing incidence of GI diseases like IBD and EOE, it's vital that we are refined in our choices with who we scope. That, in addition to other reasons why we shouldn't necessarily always scope children, such as the introduction of the BusBegan guidelines on the serological diagnosis of celiac disease, the Rome criteria empowering clinicians to be able to refrain from performing endoscopy if we don't feel it's indicated, and wider global factors such as the environmental footprint of paediatric endoscopy. All of those things really point towards us needing to refine our decisions on who we scope and how and why. So one of the aims of this study was to look at how the COVID-19 pandemic affected diagnostic yields in paediatric endoscopy, but also to look at factors that predict an abnormal scope with abnormal histology. And how did we do this? So we largely replicated the methods that we used in the previous study in 2014 by taking all first diagnostic endoscopies over a certain period. And in this study, we used two 6-month periods, one during the peak of the COVID-19 pandemic, including lockdowns, and one 2 years later, once restrictions have all been lifted and we were going back to our normal practice. We looked at all these scopes, including the clinical factors preceding the scope, endoscopic, so macroscopic findings, histological findings, and all histological findings, the biopsies, were discussed in a weekly MDT meeting with histopathology colleagues, where a final agreed outcome was reached as an MDT. We used abnormal histology as a criterion standard for abnormality, not just macroscopic abnormality. And when we gathered all this data, we used Fisher's exact test to look for significances in the differences between macroscopic and histological abnormalities in the rates between the original 2014 study and the post-pandemic group. This is a slide with a lot of information, so don't worry, I'm going to summarize it for you. It may come as no surprise that during the COVID-19 pandemic, in the first 6 months, we did far fewer first diagnostic endoscopies on children, doing only 69 procedures over 6 months in 37 children. 65% of these children were male, and the mean age was 10.9 years. The vast majority of children, 86%, underwent both OGD and colonoscopy, and very small numbers underwent OGD alone or colonoscopy alone. Now, the findings of macroscopic and histological abnormalities were significantly high. 92% of all patients had macroscopic abnormalities and 89% of all patients had histological abnormalities. These were similarly high numbers for OGD and colon. 97% had macroscopic abnormalities and 94% had histological abnormalities. In the children undergoing colonoscopy alone, all of them had both macroscopic and histological abnormalities, but in the children who underwent OGD alone, only a third did. That's one child. In the post-pandemic period, we did more procedures, 194 procedures over 6 months in 138 children. Again, the majority were male, but 54% this time, and the mean age was 9.5 years. This time, a slight majority underwent OGD alone, 55%, and 41% underwent OGD and colon. A small number underwent colonoscopy alone. This time, the macroscopic and histological abnormalities had reduced. So there were 59% of all patients had macroscopic abnormalities, with 66% of histological abnormalities in all patients. The OGD colon group, however, had 75% and 75% for each. So again, a high rate of macroscopic and histological abnormalities. In the colonoscopy alone group, where again there were small numbers, it was 50-50. And in the OGD alone group, there was a low rate of macroscopic abnormalities of 47%. However, there may be a slight element of undercalling of pathology, as they had 61% histological abnormality. We also compared the rates of histological and macroscopic abnormality between the original 2014 study and the post-pandemic group. The numbers of the intra-pandemic group were quite small, so it was difficult to make meaningful comparisons, but the post-pandemic group had larger numbers. And what we found was the macroscopic abnormality rate significantly increased in our group versus the group in 2014. Over all procedures, we had a macroscopic abnormality rate of almost 60% versus 45% back in 2014, and that was statistically significant. And that was replicated in the OGD and colonoscopy group too. We also found the histological abnormality significantly increased for all procedures, with a rate of 66% versus 36%, and the OGD group, with a rate of 61% versus 28%, and in the OGD colonoscopy group, with a rate of 75% versus 47%. This was also replicated in OGDs that excluded celiac serology positive patients, with a positive rate of 55% versus 16%. Now, if you'd like to see what the final histological diagnoses were, please have a look at figure 1. The grayscale pie chart represents the 2014 study, and the coloured pie chart represents the 2022 study that we have just done. As you can see, we had a normality rate of 33% histologically, and other main diagnoses were celiac disease, Crohn's disease, gastritis, and ulcerative colitis. As expected, the number of first diagnostic endoscopies reduced greatly during the COVID-19 pandemic, but post-pandemic returned to similar numbers to the previous study. That comes as no surprise, as during COVID and restriction times, we were not scoping as many patients. However, there was a striking increase in the percentage of patients found to have histological abnormalities identified during the pandemic, from 35% of patients in 2014 in the original study to 84%, suggesting that we were much more selective in the patients we were selecting for endoscopy during the pandemic. Interestingly, in the period after pandemic restrictions had been lifted, this still remained higher than the 2014 level, suggesting that there was a lasting change in practice in refining who we select for endoscopy since the original study. There were no delayed diagnoses or patient complaints since that change was made. Why this is, we're not entirely sure, but further work will be done to examine the reasons for this. Thank you very much for listening this far. We hope you've enjoyed our poster, and we look forward to seeing you around at Busbegan 2024.